name is Courtney. I'm one of the nurse coordinators here at Western Fertility Institute, and I'm going to give you an overview of the IVF treatment calendar. Treatment calendars can vary person to person based upon your personalized protocol. I'm going to review the most common treatment calendar, which begins with day 1 of your period. However, there are different protocols which would involve you starting medications at different points in your cycle. So we may do a mid-luteal birth control pill or medication start, which would involve you going in for a blood test before your period starts, but after ovulation has occurred. That's the mid-luteal phase. Or if you have irregular periods due to PCOS, we may have you just go in and check labs to determine the best time in your cycle to begin the medications. But starting with day 1 of your period is going to be the most common. So that's the one I'm going to review right now. So on day 1 of your period, you'd notify your coordinator your period has started, and then they're going to instruct you to start birth control pills on day 2 of your period. The birth control pills are taken for about 5 to 7 days, but that can vary, but on average about 5 to 7 days. We would have you go in for a blood test before we instruct you to take your last birth control pill. And that blood test just helps to ensure that all of your hormone levels are at baseline or are low before you take your last birth control pill and then begin medications, your stimulation medications to grow the follicles or eggs 5 days after your last birth control pill. And then during that time, after you've started your medications, you're typically gonna go in for appointments every 2 to 3 days, but that could also vary based upon your individualized protocol. So your coordinator is always going to let you know what exact days you're going to need to go in for your monitoring. You're going to go in for either just blood tests or ultrasounds and blood tests, and that helps us to determine if you're on the correct dose or not, or if we need to change anything with your protocol. Once you get a little bit closer to the retrieval, so about day 8 or day 9, you'll be seen for an ultrasound and blood test, and that will determine typically when the egg retrieval will be. And that's typically about 9 to 10 days of medication, but that can also vary person to person. Sometimes shorter duration of medication, sometimes longer, and that really just depends on your response and the size of the follicles. And then the egg retrieval is 2 days after the trigger shot. Typically by about day 8 or 9 of medications, we can determine the exact date of the egg retrieval. And then you'll have that, of course, in the office. Hope that helps to explain the IVF treatment calendar. Of course, if you have any questions about your treatment or your calendar, you can always contact your coordinator who will be happy to help you. Thanks.